next company, Ably Medical.
On a daily basis, myself and other nurses are doing things that will contribute to them being injured. With lifting and with pulling people up in bed, we're doing things every day that could be the start of an injury.
We're working with them and understanding the problem, feeling the pressure, feeling the strain of the nurses and doctors. And by that we really could start changing the way they maybe could work by redefining technology and adding technology they never had before.
So, the big issue we're trying to solve is nurse burden. Nurse burden is the most pressing issue at hospitals around the world. In Canada, 20% of nurses quit annually. In Germany, they're shutting down wards, hospitals, because they don't have enough nurses. They're importing from Philippines, from Thailand. It's a crisis management. They can't maintain the healthcare we have today. So, trying to solve this, we have done a co-design project over 3 years in Norway, Canada, Germany, and Singapore to try to redefine how healthcare should be. The problem in the industry for the last 50, 60 years is that every medtech company has tried to solve one solution. You have one bed, you have one specialized mattress for pressure ulcer, one mattress for falls, one sensor for respiration, one sensor for pulse. That's not sustainable. That's just adding to the nurse burden pressure. So we have tried to make a hospital bed that integrates all these technologies into one. That means that you don't need a more pressure mattress anymore. You don't need a support system for heavy lifting. You don't need a respiration monitoring system. You don't need manual monitoring anymore. You have one bed that solves it all. And this is very radical innovation. It's Quantumsprung, they call it in Germany, because it takes a totally different leap in terms of healthcare. So we have built a hardware system from scratch, a bed that can solve all the movement you need in the bed without using what you use 2 nurses today, you can only use half in our bed. We have a sensor software system that non-intrusive, no wires, anything, gets respiration, pulse, weight, movement, temperature. We're also working now on blood pressure and oximetry, and it looks likely we can do that also, non-intrusively. That means we have a hub, or a data store of data. And that's why we built this inpatient data store in addition, where our bed could be a hub for other technologies, other companies around the world that have interesting technologies. For example, we have a Singapore startups that work for 10 years on sleep analysis. So we're giving them data and the hospitals can buy sleep analysis reports. An Israeli company works on pain detection through voice. We're using our bed as a hub to provide this service. We're working with companies with sepsis, with stroke, and our bed could do preventive maintenance or preventive healthcare by analyzing this data. So we have strong partnerships around the world. We have contracts with hospitals in Norway, Germany, Canada, Netherlands, Singapore. We have production partners, strong production partnerships from BMW, Volkswagen in Germany. We have 20 employees in Norway, Canada, and Germany. We're growing, and our aim is to be the #1 provider of smart beds in the world. And last week I had a really good discussion with strong partnerships that could really make this happening. We just done due diligence in a €6 million round. It's a strong Norwegian fund that's been doing the due diligence, so the cap table is now open for investment. So please get in touch with me afterwards to be part of this journey. Thank you.
Thanks a lot for the presentation. I wonder, where are you in 5 years financially?
Financially, we're looking for, this is a $4.7 billion market just for the bed and mattress. We're approaching 20% of the hospital bed market, which in Germany is 100,000 beds. We then have a revenue around $1.5 billion. We have in just a strategic partner, first market is the German-speaking countries, Benelux, France, and Canada. And through our partnerships there, we have an escalated plan around 5,000 beds in 2025.
Thanks.
Thank you. I love that you can actually integrate other types of technologies with this bed. I think that's very unique and an awesome feature. How are you going to make sure that people know about this? Is it going to be up to the different hospitals that are buying the bed to add on technologies that they want to add? Is it going to be up to you to kind of sell this solution to other technology providers?
For nurses, they just need one provider. The problem in the market is 20, 30 providers. So we are the hub. We're providing these services through this bed. We don't need, so that's why we're adding these technologies to make the fuss go away, make one certified provider. So it's very important to unify everybody instead of 50, 100 suppliers we have today.
Thank you.
Thank you.
All right. Thank you, Ably Medical.